There's always more than one way to skin a cat, the saying goes. But there's also more than one way to treat an injury or to diagnose something. So, in the medical device world, when we have to write a document that says alternative treatments or alternative therapies or alternative diagnosis, we have to come up with a strategy for how we're going to write that for the FDA. De novo submissions and PMA submissions require a benefit risk analysis. So, part of that decision making process is identifying not only what the benefits of your device are, but what are the benefits relative to the alternative options that you have. So, we'll take two simple examples. One maybe a little more complicated than the other one. But the first one, we'll say you have a cut. Okay, it's a deep cut, it's a gash. What do you need? Probably stitches. But in the modern world of medical devices, we have options. We don't just have sutures or stitches now. We have other things that we can treat you with. So one of those options is a bioglue. If you've ever had a cut on your finger or your hand and you went to the ER to be stitched up, they might not have even used stitches. They might have used a bioglue. And they call it a bioglue, as I'm using that as a general term, but there are several different brands out there of cyanoacrylate adhesives that can be used topically on your skin. And when you read the indication for use, it says it's supposed to be used in addition to or in conjunction with sutures. But a lot of surgeons will in the ER will use just that and not use any sutures at all. That's their choice. But why would they do that? Well, they don't have to give you a shot for a temporary anesthesia for that local area, lidocaine or something like that. They also don't have to open up a suture and spend the time suturing. It takes less time to apply the cyanoacrylate to the cut that you have. But they're not going to do that if there's going to be a lot of tension on that wound and the bioglue won't be strong enough. So then they would use sutures plus the bioglue. There have also been some alternative treatments out there other than bioglues, or they can be used with bioglues instead of sutures. One of those is, I think the brand name they have is Steri-Strips. They're like a paper tape that goes across the wound and it pulls the two edges together. So these are all different. Sorry about that. These are all different treatments that you can use as an alternative to sutures to approximate two edges of a wound together, to get those two parts to adhere together. So you have to pick which one of these am I going to use. And so when we submit a 510K for a new technology and they have to do a benefit risk analysis, the FDA wants you to explain what are the alternatives to your device? What are the alternative treatments? They might not just be another device, they might be a drug also. So they also want you to consider drugs. Maybe you've come up with a surgical way to treat somebody for a heart defect, and some other company has come up with a drug treatment. Well, one, I have to cut open your chest, and this other device, I don't. I just give you a pill. So, which one has the better risk benefit profile? Well, I'm not sure because the drug works systemically and it works over a long time. You have to pay for it over a long period of time. So, I'm not sure which is the best method. But when I'm dealing with a device that I'm cutting you open, that's going to be very invasive. It's going to be one time. You're not going to have the long term costs, but you're also going to have a high level of risk for the time when you go through the surgery, particularly if it's something like open heart surgery. I'll use another example for you. If we have a device that's going to be, if we have a device that's going to be a product to help me lose weight, for that particular device, I want to have something that I want to have something that's going to be something that doesn't affect me for the rest of my life, that I have to live with forever, that isn't going to affect my ability of my body to absorb nutrients, to vitamins and things that I need. So if I go with a permanent solution like a gastric bypass procedure, that's going to be a permanent solution. If I go with a lap band procedure, that lap band device is a temporary solution and I can remove it from the body. They also have balls that they put inside the stomach, and they will take up space in your stomach, and those can be potentially removed as well. So certain things you can are reversible, and certain things are not reversible. And there's a big risk if it's not reversible, and it causes you've taken away the patient's ability to absorb nutrients. But at the same time, you want it to be effective in helping that patient lose weight and lose weight fairly quickly. Another option would you might be giving the patient some sort of a drug to lose weight. So that would be another alternative treatment or technique for caring for these patients to help them lose weight. So you have always more than one way to treat a patient, and you've got to decide which is the best method to treat this patient. That's what the FDA is looking for. They only give you a little text box to put this answer in, but that's what they want in that de novo submission or a PMA submission, explaining what is the alternative treatments or procedures that you can use for this same indication. If you have any other questions for future topics for live streaming on Fridays, please put it in the comments below. Or if you have additional clarification questions for this particular one, please let us know. Have a great weekend. Bye-bye.